Welcome. This is a summary of the COVID-19 pandemic status for the month of July 2020. I've changed from doing these weekly to monthly so we can get a better overview of what's going on over the long term. So let's summarize what we're going to cover today. First, we're going to go over some of the basic global COVID-19 statistics. Then we're going to look at the status of the 10 worst countries and how they've fared over the last month. Then look in more detail at the US statistics. Ask the question of whether this is an indication of a second wave or just merely a continuation of the first wave. Cover a few mythbusters. There's still a lot of misinformation going around out there. And a much more concern, I think, is the long-term effects of COVID-19 are beginning to manifest themselves in those that have recovered from the disease, and that is quite worrying. This is a map showing the spread of COVID-19 as of the 31st of July 2020. The inset in the bottom left is the same map for July 1st of 2020, and you can see there are quite a number of differences. South America is beginning to fill in, as is Africa. India has gone to a darker shade, as has Australia. And some of the islands in the southeast of Asia are also filling in. Overall, we've passed 17 million and well on the way to 18 million cases worldwide. That compares with 10.4 million at the beginning of July. We have 680,000 deaths, compared with just over 500,000 deaths at the beginning of the month. Recovery is pleasingly up to about 10 million people, as opposed to 5 million at the beginning of the month. However, the difference between the number recovered and the total cases is still about 6 million. So there's 6 million cases that haven't been resolved as yet. And so this means all these numbers are going to go up quite significantly. Now let's take a look at the 10 worst performing countries, at least with respect to the total number of cases that they've got. Leading the way is the United States with 4.6 million, and Brazil in second place. The US also leads in the number of deaths with 156,000. The two countries that have produced the largest increase over the last month are India and South Africa, and now those are two very worrying trends, although they both have relatively low death rates at the moment. The UK has dropped down the table to 10th place and probably will drop off the table in the next month or so, as other countries are coming up fast behind. There are several places around the globe that are of particular concern. Victoria in Australia have declared a state of emergency because of the sudden increase in the number of cases there. Australia, up to this point, had thought to have been doing an excellent case of controlling this virus, but that seems to be breaking down now. There's been a major surge in South Africa, making it the worst country in the continent. India may soon surpass the US, it's coming up so quickly. There's been an outbreak in northeastern Spain, which has caused various countries to close their borders to Spanish travellers. In the states of Florida, Texas, Southern California, Alabama and South Carolina are all showing fairly major and rapid increases in the number of cases. This is a map showing the number of new infections over the last 2 weeks in the United States. The darker the colour, the more infections there are. You see most of the infections are concentrated across the southern half of the country, with a few odd hotspots in some of the other states. The US has now surpassed 4.7 million cases, with 157,000 deaths. That's more than the deaths in World War I, Korea, Vietnam, Afghanistan, Gulf, Iraq and 9/11 combined. 13 states have now got over 100,000 cases. That was only 5 on the 1st of July. And 12 states have over 50,000 cases, and that was only 3 on the 1st of July. So you see there's been a massive increase in the number of cases across the country. These two plots show the number of cases in various states over the last few months. The top graph shows the states that have over 100,000 cases. The bottom graph shows states with over 50,000 cases. And one of the things to note here is that all but 3 of them, New York, New Jersey and Massachusetts, have an exponential rise. So we are really going through a new outbreak of the disease. Whether this is the second wave or a continuation of the first is yet to be seen. Another worrying factor here is that the COVID death rate has started to ease up again after showing several weeks of decline. For the last 4 weeks, the number has increased, and now we're averaging over 1,000 deaths a day. Let's take a step back from Wonderland and actually talk some sense about this particular disease. There's lots of myths going around this last month, and I would like to repeat that these are in fact just nonsense. There is no safe or effective vaccine for COVID-19 as yet, nor is there any form of cure. We're probably going to have to wait quite some time before that's universally available. Some medications help lower the death rate or shorten hospital stays, that's true, but none of them prevent you from getting the disease, and none of them guarantee you won't get very, very sick. Hydroxychloroquine has not been shown to be safe or effective as yet. Wearing a mask does not make it more likely that you catch COVID-19, as certain congressmen are claiming. Nor does it make it any less easy to breathe, as certain people who are trying to get out of wearing a mask are claiming. It does protect you from catching COVID-19 from others, and in fact it's even more effective at protecting others from catching COVID-19 from you. Only social distancing and wearing a mask works to slow the spread of COVID-19. Not one or the other, but both. Perhaps even more worrying is there are indications that there are some long-term after effects of catching this disease. One is lethargy, which seems to be associated with an inflammation of the heart muscle. As one patient said, "I used to go to the gym 3 times a week. Now my physical activity is bed to couch and maybe couch to a kitchen." People are complaining of long-term coughs and shortness of breath, indicating that there's some problem with lung capacity or lung efficiency after having caught this disease. Many are complaining of headaches, indicating some possible brain and neurological issues. Also, many are complaining of dizziness and disorientation weeks after so-called recovery, in fact in some cases even months. This is worrying because this indicates that there's a long-term health impact of this particular disease that we may not have fathomed out as yet. Jumping to conclusions is always a bad thing, especially if you don't have all the facts, and certainly with this disease we don't have all the facts as yet. However, it's clear that the pandemic is still out of control in many countries, and even those countries that have it under control currently can easily slip back into an out of control situation, as we've seen several countries done already. We have concerns about a second wave, or what might still be the continuation of the first wave, as numbers are rising exponentially still. And possibly most concerning of all are the long-term symptoms that seem to be being presented by some of those that have recovered from the disease. This may make them more vulnerable to the second wave, the cold season, which goes generally from September to April, at least in the northern hemisphere, and the flu season, which goes from November to March, again in the northern hemisphere. So maybe we have to be just as careful about social distancing and wearing masks for those 2 seasons as we have been with COVID-19, even if COVID-19 goes away. So until next time, stay safe and goodbye.